just because
But
our
we-
contribution.
Well, I think it's essential to have cooperation between the docs using the lasers that you come up with and seeing what the clinical effects are. So, for example, with the IPL device that was shifted over to green, we noticed that we did not have a short enough pulse duration to get some of the smaller telangiectasias on the face. We went back to you, and you were able to manipulate the device or change the energy source. I'm not sure exactly what you did, but this way we were able to shorten the pulse duration, get enough energy out during a shorter pulse in order to treat smaller telangiectasia. So that's how the cooperation occurs, yeah. And that's how it should be. And that's the problem that the ACCME doesn't understand, that in this field we need to talk about devices, mention which device is which. It's not like talking about drugs and drugs competing against each other. These are very sophisticated devices, as you've just seen, so that we need to talk about it. We need to have an intimate relation with industry, and eventually they'll understand, and there'll be more CME sessions for those of us in clinical practice. So I was asked to just do the very simple thing. Radio frequency in every dermatologist's office, you're going to see a bifurcator, and I'm going to explain what that is in just a moment. So obviously it's used every day in medicine, reducing blood loss, faster healing times because of smaller incisions, less pain and discomfort for the patient. Even when we do a shave biopsy, we take our bifurcator and we go around the edge, and that smooths out the edge and leaves less of a sharp transition between the biopsy area and the surrounding skin. And in deeper surgery with tumor removal, it's really used, and it's an essential way to stop bleeding and to remove tumors from the liver, lung, kidney, and bone even. So the RF generators work by alternating current, and that's why you have the frequency of RF. The current generates an electromagnetic field. The field is delivered to the tissue through an electrode, and this can be, as Dr. Altshuler just showed, either through just a single dispersive electrode, a bipolar, or with the patient grounded, which would be called unipolar. And they do have safety features. So we used to not be able to treat people with pacemakers. Now they're insulated, the pacemakers, and because RF is so commonly used in surgery, we can use them even with patients on pacemakers. So the frequency range is 100 kilohertz to 1 megahertz, which is quite a range. The devices do not need to be as sophisticated as the laser devices that Dr. Altshuler was talking about. Lower frequencies are used for larger areas of the body. They tend to spread more, and the frequency is carefully chosen to balance precision with depth of penetration. So electrocautery versus electrosurgery, that's the main point for dermatology to understand, is that electrocautery uses electrical energy to cut tissue and stop bleeding, and electrosurgery is more precise and versatile and can be used for a wide range of surgeries. We pretty much are using electrocautery, and hence comes the name bifurcator. These are dedicated non-grounded machines without a dispersive electrode, and they're low power. They're usually, as we mentioned, lower frequency, 100 to 500 kilohertz, and the self-capacitance of the patient's body is what makes it sort of not disperse very far and just act very, very locally. And there are even different types of tips. Some, I like the ones that are like to a very sharp point. They're triangular and allow very precise application of RF energy, even down to 1 watt, because you want to not heat the skin up too much to cause a scar. And I didn't know this, and this came from ChatGPT. I asked, like, what is really, why do we call it a hyfricator? And it's a high-frequency eradicator, and that's a hyfricator. So it's a single electrode, non-isolated, low-powered electrosurgical device intended for office use. Even so, though, it seems relatively harmless. There have been numerous cases reported where an alcohol-based solution is placed on the skin, and then you fire this, and there's a little spark at the end of this very harmless device, but then things get caught on fire, whether it's a drape around the patient or the patient's hair. So you still have to be cautious when you're using that you do not have anything flammable around, and they're not do not have the capability of cutting tissue. And this said, like, inside the machine. So I said, okay, ChatGPT, can I see a schematic of what's in a hyfricator? And this is it. So it looks like a relatively simple device, but it's been a long time since I did electrical physics, so I would need one of these professors to explain this. But basically, you can do a bipolar or a single dispersive electrode will come out the end of this, and it's the frequency is highly regulated and filtered through a circuit like this. And I'm not going to go through this because I can't explain every aspect of it. So the one on the left is where you see this is pretty much in every dermatologist's office. If they don't have one of those hanging on the wall, I would leave that office because they're not going to be able to do, like, even simple biopsies and stop any bleeding. But basically these work from like 1 to 20 watts. There's a low mode, there's a high mode. As you can see, there are different areas where you can place the delivery handpiece, and we use the low mode mainly, and it's great because I can adjust it to 1 or 2 watts and get a very, very nice result without causing scarring. These are the bigger cutting, coagulating machines. These are higher frequency. These will allow you to, and they're typically called Bovie because that was the company that first came out with it. And they have much more power. You can ground the patient and go very, very deep in terms of coagulating vessels in general surgery. Let's see. So in summary, 100 to 500 kilohertz for the hyfricator, a relatively simple device compared and low-powered device, commonly used in the office setting. Higher frequency for coagulators up to 1 megahertz, and they're both used in electrosurgery, but they have key differences. And as I mentioned, low power for the hyfricator. We call it electrodesiccation, electrocoagulation, but again, we learn very early on in our derm residency how to use those, and if you're in a surgical residency, you learn how to use a Bovie. I've already gone over these points, and I don't want to belabor them, and thank you very much for your attention.